So our learning objectives are, we'll talk briefly on the epidemiology of cervical cancer, the cervix, its location, its functions, signs and symptoms of cervical cancer and treatment, prevention of cervical cancer, and our role as pharmacists in the prevention of cervical cancer. Cervical cancer is the fourth most common gynecological cancer in women. Sexually active individuals, regardless of whether you're a male or female, will be infected with at least one strain. There are over 200 strains of the human papillomavirus, over 200. They're categorized into the high risk and the low risk strains. So the fact that I just said that sexually active individuals will be infected with at least one strain doesn't necessarily mean that strain, it will lead to cervical cancer. As we go on, I'm going to explain further. And women living with HIV are 6 times more likely to develop cervical cancer compared to women without HIV, for obvious reasons. We all know that HIV attacks the immune system, and when the immune system is compromised, it's easy for them to pick up all kinds of infections. So that explains it. And then typically, cervical cancer takes a long time to manifest. There are different stages. Basically, the range is between 15 and 20 years for an abnormal cell to become cancerous. But of course, in women who have weakened immune systems, like those who are infected with HIV, the process is shorter. Usually takes 5 to 10 years. As I had mentioned before, the virus, the human papilloma virus, falls into 2 categories. You have the high risk and the low risk. For the high risk, you have 12 different types or serotypes of the strain. You have the 16, 18, 31, 33, and it goes on all up to 59. Now, the 16 and the 18 are the focus in today's presentation because they are the ones that cause the cervical cancer. In fact, 70% of women who come down with cervical cancer are infected by these 2 strains, 16 and 18. Now, the infection, it needs to be persistent. The fact that you have been exposed to a particular strain doesn't necessarily mean it will eventually turn out to be cancer, but persistent exposure to certain strains, which I just mentioned, serotype 18, 16, and 18, are the ones that may eventually, lead you into cancer. But of course, there's so many risk factors, which I'm going to point out as we move on. Now, for females from the ages 9 to 45, if they are infected with the high risk serotypes of the human papilloma virus, there's a possibility that they may have cervical or vulva, vagina, anal, or oropharyngeal cancers. The males within the same age range too may have anal, penile shaft, and oropharyngeal cancers as well. I must inform us that infection, depending on so many factors, especially the immune system of the individual, usually clears up within 24 months. But if it doesn't, then there are procedures and strategies and techniques that are applied to ensure that it doesn't progress to a later stage. And I also must let us know that out of the 5 gynecological cancers that affect females, regardless of the race, be it African, Caucasian, European, the 5 gynecological cancers are cervical, ovarian, uterine, vagina, and vulva. Out of the 5 gynecological cancers I just mentioned, cervical cancer is the fourth most common to affect women. During the COVID period, precisely 2020, there were 600 new cases of HPV, permit me to use that acronym, human papillomavirus, HPV, new cases, and 342 deaths that were recorded. We just to let us know that the human papillomavirus is sexually transmitted. It's sexually transmitted. So that being said, 75 to 85% of the population, especially in the sub-Saharan Africa, that are infected with this particular virus comes from the low middle income country. Cervical cancer imposes substantial burden on the woman, family, and the nation at large. It also affects the socioeconomic aspects and the overall well-being of the victim. Coming down to Nigeria, we have been talking about the global impact of cervical cancer on the population. Now, coming down to Nigeria, the prevalence of the HPV virus affects, according to statistics, affects 60.9 million women in Nigeria. Okay, and in Nigeria, cervical cancer cervical cancer is the most common, second most common cancer out of the gynecological cancers. The second most common cancer in Nigeria that's affecting Nigerian women. 12,000, a little over 12,000 women are diagnosed each year. 7,000, a little over 7,000 die from it each year in Nigeria. Now, coming to the cause and treatment. Cervical cancer, out of the 5 gynecological cancers, is the cancer that can easily be tested. The other ones which I mentioned before, most of the time, by the time you start having the symptoms, it's already too late. But cervical cancer, thank God, has a test, and we'll come to that. So it's 90% treatable once it's caught in time. It's 90% treatable. And of course, we'll get to it. The preventive measures are the vaccination and certain tests. I'm going to jump right to it. The federal government, as of 25th of September this year, brought in 6 million doses of a vaccine, specifically brought in a vaccine. I was distracted. Brought in a vaccine. And what they intend to do is that they tend to reach out to the young ladies, adolescents, and women in terms of vaccination, immunization, to prevent them from picking up this particular virus. Currently, there are 16 states that are going to benefit. It's done in 2 phases. The first phase has already kicked off. As I mentioned before, it started on the 25th of September this year. So there are 16 states that are currently benefiting from this rollout scheme. And thereafter, the early part of next year, the first quarter of next year, the remaining 21 states are going to benefit. Now, the states that should be or are benefiting right now are Abia, Adamawa, Lagos, Akwa Ibom, Bayelsa, Nasarawa, Jigawa, Ogun, Taraba, Kano, Benue, Osun, FCT, Kebbi, Bauchi, and Enugu. These states should currently have these vaccines now. And of course, this vaccine can only, since it was brought in by the federal government, it can only be found in the institutions okay, run by the government. Now the cervix, we keep on hearing about cervix. What exactly is the cervix and where is it situated? Permit me to explain using my laser. Okay. So this is the cervix. This whole section here is the cervix. Now the cervix is a muscular tunnel-like organ that begins at this part. That's the cervix. This is the uterus. I beg your pardon. This whole part is the uterus. The cervix starts from here, the internal os, and ends just above the vagina, known as the external os. So this portion here is the cervix, okay? And this portion is where the cancer usually starts from. It's called the transformation zone, this section here. So as I mentioned before, this part is what is usually affected. That's called the transformation zone. It's the region between the endocervix and the ectocervix. I just mentioned it. I can take us back. That is here. That's the endocervix, this small region. That's where it is. I hope people. Hello?
It's going.
Yeah, we are
Hello?
good.
Okay. Just want to be sure. Okay. So the cervix is made up of two cells. You have the glandular cell and you have the squamous cell. The glandular cell lines the inner part of the cervical canal, while the squamous cell lines the outer part, and that's where the abnormality of the cells usually take place and become precancerous. Now, the functions of the cervix, they are fourfold. You have helps drain the menstrual blood from females, from the uterus, and expelled to the vagina. It acts as a tunnel during childbirth. It produces mucus, to enable fertility, the sperm moving up to the uterus. It helps it find its way, navigate its way to the uterus, to the fallopian tube, and then the egg. And then it protects the uterus from bacteria and other foreign objects. Now, these are the risk factors for contacting the human papilloma virus. Of course, obviously, the infection of the virus is the first thing. The next is the early age at first sexual intercourse, called the AFSI. You'll probably be wondering, it's not because the particular individual has started early, therefore she'll have so many sexual partners and be exposed. That is not really the reason. The main reason is because her cervix is not fully matured. It's immature and it's predisposed to the infection, and persistent infection is predisposed to the virus, settling in the cells of the cervix and then become persistent and then eventually develop. So that's the main reason. It's not because she's going to have so many sexual partners. The main reason is the biological predisposition to the virus. Then the third factor is having multiple sexual partners. The fourth is having more than 3 children. The fifth is smoking cigarettes. We do know that smoking weakens the immune system and also causes mutation of the cells. So that's where the smoking comes in. Then using oral contraceptives, especially the combined oral contraceptives. We also know that combined oral contraceptives consist of the progesterone and the estrogen. And the estrogen has been known to be fuel for the growth of abnormal cells, pre-cancerous cells too, and oncologic cancer cells. And then, of course, infection with HIV, because HIV in and itself weakens the immune system. So once the immune system is weakened, the body can pick up different kinds of infections. Now, the importance of early detection and prevention. Prevention helps in screening. Now, the screening involves identifying and treating of precancerous lesions. The second is it helps to identify abnormal cells before they progress to cancer. Remember, I mentioned earlier that cervical cancer is a very slow growing cancer. It takes between 15 and 20 years, depending on the immune status of that individual. The third point is that with early intervention, you reduce the risk of invasive procedures, as well as there's going to be more effective treatment options when it started early against when it has already progressed to cancer. Then we now start talking about certain interventions and then drugs for cancer, which we know are very, very expensive. So that's another reason. Then the fourth one is that it reduces the burden of the HPV infection by vaccination, by lifestyle modifications, and of course, early detection. And then the fifth and the most important is cost effective. And we're going to get to that point. Cost effective in the sense that, yes, the vaccines may be expensive, but then again, I mentioned that we have free vaccines now by the federal government that just brought them in. So peradventure, a patient cannot access these free vaccines. The vaccine it's for a period of time, for about a year, compared to if that particular individual actually comes down with cancer. There are several stages, and cancer, most of the time, it's in as much as you have the remission stages and all that, but you're never really free of it. So at the end of the day, it turns out to be cost effective. So what are the signs and symptoms? Well, there are bleeding between periods. There's dyspareunia, which means painful sex. There are longer and heavier periods than usual, unusual discharge, and bleeding after menopause. I must interject that the fact that there's unusual discharge and there are longer and heavier periods doesn't necessarily mean that you have the infection. It doesn't mean that. But what I will emphasize is that bleeding after menopause is a very strong indicator that something is amiss. Very strong indicator that something is amiss, and it must be checked out. We have come to preventive measures. Now, the preventive measures are twofold. We have the primary and the secondary. The primary involves vaccination or immunization by certain vaccines. It also involves using the condom, limiting sexual partners, eating a balanced diet, and smoking cessation. While the secondary preventive measure involves the pap smear and or the test for the virus itself. In the rural areas, for those population that cannot access the above mentioned, the pap smear, the HPV test, and the vaccines, there's a simple technique or test that is used. You know, once the cervix is visible, acetic acid is used to dampen that particular area. And once that area indicates or the color changes, usually if there are any abnormal cells, the cells turn white once it comes in contact with acetic acid. So that's a very, very easy and cheap means of detecting abnormality of cervical cells. And it also is used as a confirmatory test as well. Peradventure, these tests I mentioned before, the pap smear and the HPV test, is not available. There are several screening programs that are being used globally. The first one is the National Cancer Institute, excuse me, which stipulates that the HPV test, the human papilloma virus test, is done every 5 years on its own, or it can be combined with the pap smear, which is also done every 5 years, or the pap smear can be done every 3 years on its own as a single entity. And then the second one is by the WHO, the World Health Organization, which involves, again, sourcing for the HPV virus, applying the screen triage, and subsequent interventions. Now, the screen triage is actually what I've mentioned before, using what we call the visual inspection identification. What it does is that, as I mentioned before, you use acetic acid, and the acetic acid is actually diluted vinegar solution that is applied to the cervix. And then if there are any abnormal cells, it shows up as whitish, and of course the texture of the cells change. So that's what the screen triage is all about. And then the third screening program is by the American Cancer Society, which prefers just using the HPV test, the human papilloma virus testing, as its own preferred approach. As I mentioned before, the primary prevention is vaccination or immunizing an individual with a vaccine. Now, the two vaccines that are available in Nigeria and worldwide, globally, is the Gardasil 4, Gardasil 9, and Cervarix. There are differences between them. Now, the Gardasil 4, which is slightly cheaper, it protects the strains that produce cervical cancer, oral and throat cancer, and genital warts. So it's sensitive to the serotype 6, 11, 16, and 18. As you can see, 16 and 18 are highlighted, which means that those are the dangerous strains we must look out for. Then Gardasil 9, which is more expensive, has a wider coverage, as we can see. It also protects the individual, apart from cervical cancer, it protects the individual against vaginal, vulvar, anal, throat, and the back of the mouth, as well as genital warts. For Cervarix is disadvantaged in that it only protects the individual against two strains, the 16 and the 18, which means it doesn't protect the individual against genital warts. Just to let us know that currently Gardasil 4 goes for 100,000 for the 2 doses or the 1 dose, depending on the age. We'll come there, get to that point. And then Gardasil 9 goes for 200,000, 250, which is quite expensive. The cost price for Gardasil is about 18 to 20, depending on who has it per dose. For the immunocompromised victims, they may have, or they're advised to take more than 3 doses of Cervarix. Now, the dose administration for children, remember I said I was going to get to the dose now. For children or for adolescents, let me put it that way, between 9 and 14, they require just a single dose of either variant. And then as they get older, once they cross over 14 years, they require 2 doses. Now, the first dose, they start the first dose. The second dose is usually after 5 months. And WHO states that once a dose is skipped for whatever reason, it doesn't matter. But in Nigeria, once a dose is skipped, it's advisable to repeat it. Then for Cervix, as I mentioned before, has 3 doses. You have the first dose. The second dose is usually given after 1 month, and then the third dose is given after 5 months. Of course, the vaccines, both of them are contraindicated when it comes to the pregnant woman, and of course, if the individual is hypersensitive to any of the excipients. The pap smear, for females between the ages of 9 and 21 years of age, they are advised to repeat it every 3 years. Of course, if for any reason there's some question regarding the results that came in, maybe in terms of abnormal cells, then it's meant to be repeated every 6 months, every 6 months, every 6 months. And then for women who are 30, between the ages of 30 and 65 years of age, the pap smear and the HPV test is open to them. They are meant to be done every 5 years. If there are any abnormalities found, then it's going to be reduced every year. They're meant to carry out that test. Cervical cancer rarely occurs in women who are tested regularly. Now, for the HPV test, it's not recommended, obviously, it's not recommended in men. And it's recommended for women between the ages of 21 and 65 years of age. Now, we have come to the roles of the pharmacists regarding cervical cancer prevention. The first and most important is education. We educate our clients on the, first of all, the dangers of cervical cancer. Then secondly, the importance of the primary prevention, which I had mentioned before, the vaccine, and then of course, using the condom, smoking cessation, balanced diet, and reducing the partners that they meet, even when the condom is being used. And of course, the secondary preventive measures, which involve the pap smear and the HPV test. In addition to that, in addition to the education of the preventive measures, we should also educate our clients on healthy lifestyles, on a regular and balanced diet, on cessation, as I mentioned before, cessation of smoking and physical activities. And then we also advise them on a vaccination. We could have a dossier when it's time, because people tend to forget because of the duration between the first and the second dose. We can have a dossier where we call them, chat them up when the time is, when the appointment date is drawing closer. We could call them, send them an email, send them a WhatsApp message to remind them that the next dose is due. And then most importantly is creating awareness through anywhere you find yourself. For me, I'm an advocate for it. So anywhere I find myself, be it church, if I have an opportunity to talk to the congregation, I do a lot of medical outreaches. So I always use that as an opportunity. And you'll be surprised when you're talking about cervical cancer, when it's done, you see, especially the females coming to ask you questions that their mom had this, they didn't even know that was what the mom died of, blah, 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 you know. And I'd like to interject here that it's a very sad story. One of our technicians who currently works with me, I remember years ago, I used to encourage her because the screening um, unit is just opposite the pharmacy. I used to encourage her to, you know, pop in, and then it was even free, and it's still free now under the NHIS. And she should pop in and go and do. She's about 40, 45. She should pop in and, do the pap smear. She said it's not her portion. So that's the mentality, that's the myth they have. We're very religious in this part of the world, but right now, as we speak, she's currently in her last stage. In fact, the surgeons, had already told her they can't operate on her. They had sent her to, I think, the east, somewhere, Enugu, to do radiology because the stage at which it is now, it's inoperable. And if they decide to go in there, she'll, bleed to death. So it's painful because it's preventable. If only she had listened. And then it wasn't even free. So it's important that we create the awareness wherever we find ourselves. That's our role as pharmacists, to educate the populace on what cervical cancer is and how to prevent it. The neighborhood where we live, our relatives, our friends, family members, important. And then if we come to a point where we are not sure what it is, like this particular lady I'm talking about, that's the case study I was talking about. She first complained about bleeding. I do know she has a myoma, which is a fibroid, so I assumed it was heavy, the fibroid acting out and she was bleeding heavily. But then when the pain started setting in, then, I had to refer her. I had to refer her only for us to get the news that it's a bad case. So you need to know when to refer your clients. Don't handle it. If the client is bleeding, if you have ruled out other causes of bleeding, I'm not talking about a menopausal woman. A menopausal woman must be referred regardless. But for the younger women, if you have ruled out by the time they do the hormone profile, and they have ruled out, it's not, and they, of course, you have the sonogram. Those ones, I mean, if you do a sonogram, it will be able to tell you, what is going on there and all that. But if we know we can't handle it, we should kindly refer to the appropriate physician. And then there are vaccination strategies that clinical pharmacists can also play a role in. Of course, we thank God for this certification now. A lot of pharmacists in the country now are administering vaccines. That's a good thing. So when that is done, we are able to improve and expand the coverage regarding the vaccination rates. And then we're able to dispel myths. Like this lady I was talking about now, she didn't think it was necessary. She says not her portion. She was looking at the spiritual part of it. So by the time we're able to speak to them on the importance and answer their questions on what it's all about, how does it come about, that's the role, that's education for us. They are more informed. And then we are also advised to collaborate with our colleagues, the medics, especially those in the oncology departments, to see what we can do. I do know now, we thank God for CPAN, because CPAN has a lot of specialties. It has oncology specialties. So the oncologic pharmacists can liaise, with the medics, to see how they can improve vaccinating or immunization of these clients, or even how his or her own role as a clinical pharmacist can educate. That's where we come in as well. Educate the client on, these things. And of course, community outreach, which was what I meant before. We engage in community outreach programs as well to educate the populace. These are my references. Thank you very much for listening. Thank you. I hope I was audible. Thank you. Pharmacy Manuel.
Yes, I'm here. Good evening.
Okay, good evening.
Yeah, very, very educative presentation by Dr. Tricia on cervical cancer. Very, very enriching. So I don't know. It's time for Q&A, question and answer session. So anyone with question can just signify by raising his or her hands up. Anyone with a question? Pharmacist Ibrahim, from Rakia, from Chika. Okay, as I can see from Dr. Joseph Maduye and many more persons. So anyone with a question? Question. Or can everyone be unmuted so that everyone be unmuted so that anyone with a question can talk?
No, I think everyone should be muted. There will be a lot of interference. All they need to do is raise their hand, and then you will identify them. And if everybody unmutes,
Okay.
it's going to be really, yeah.
Okay. Yeah. Okay. Pharmacist Sanusi.
Everybody.
Yeah.
Hello, good evening, everybody.
Yeah, good evening.
It's a wonderful presentation. Yeah, it's a really wonderful presentation, and I thank the presenter for the work well done. Please, my question is just to ask if a woman is complaining of a persistent pelvic pain, maybe when she's walking or she sits down for a quite some hours, and she's experiencing kind of a pains, but there is no blood of any form. How can pharmacists intervene in such?
Okay. Thank you so much. Thank you so much for that question. I would advise you to refer. You know why? You know why? Why you need to refer? Because pelvic pain can be anything. First of all, we really don't know. I mean, you take her history. You haven't told me if it's an elderly lady, if she's menstruating, if she's obese. You need to take her history first. We have always been taught in Japan that we should take her history. Pardon?
Yes, we are with you.
Yeah, so you can't do. Hello?
I'm still with you.
Yes, I advise you to refer. There's little you can do because you can't see much. It could be anything, but of course you need to do your history taking first. That will help you help you, it will steer you in the right direction. You need to know, is she obese? Okay, you said there's no bleeding, but there's so many other things you need to find out. Does she have pain during sex? How old is she? You know, all these things you need to find out from the history taking. If after you have done your history taking and you haven't reached a conclusion, then you refer her. She needs to do a sonogram to be sure that nothing else is growing in there. Very important. Thank you.
All right. Thank you very much, Dr. Trisha, for that answer. Is there
Somebody's
any
hand,
other
yes.
question?
I can see a Fatima. Fatima Sanusi.
Fatima.
Her hand, is she the lady who just asked a
Yeah,
question? Her
let
hand is raised.
let me raise that. I just have the question.
Okay, please, go on. Please put our mics, please. Thank you very much. There's a lot of interference in the background. Thank you.
Any other question from Pharmacist Fatima?
Yeah.
Pharmacist Fatima Sanusi. Okay. Any other question? Is there any other question? Any other person with a question?
Thomas Emmanuel, if there are no more questions, I think the national chairman is currently with us. I don't know if you want to say a word or two.
Yes.
But,
Okay,
yeah.
I can see. Okay, Dr. Joseph Madu, our national chairman. Sir?
Say something.
Hello. Good evening, everyone. Please, can you hear me clearly?
Yes, we can, loud and clear.
Okay. Let me thank the presenter, Dr. Kukigan, and the moderator, as well as all the participants. I'm so sorry I joined very, very late. I just came in. I joined very late. And permit me to digress a little, please. I went to SIPAN National Education Committee, and I saw Dr. Bello post something there that the number of participants are too low. I want to tell us something so that this kind of thing doesn't occur next time. I know that the presenter must have spent a lot of time. It's not easy to prepare for lectures. And when you come and make your presentation, you have very few people. Out of about 20 persons that attended this meeting this night, we have one person that asked question. So let me assume that if we have sorry, can you still hear me? Sorry. Hello?
Hello.
We are hearing you loud and clear.
Yes. Okay, thank you.
Yes,
very
we
much.
can hear you.
Okay, so yes, so what I was saying is that if we have out of 20 persons and one person asked question, assuming we have up to 40 persons, maybe we would have had up to 2 or 3 questions. And sometimes when one person asks question or 2 persons, from there you discover that other questions can also come up. That's the essence of all this meeting and everything. I just personally want to advise the education committee that we have about 800 persons on SIPAN platform, about 800 and something persons on SIPAN platform. But that does not mean that when you post something there, all the 800 people will see it. No, it may even be tomorrow. So I want to advise us next time, please, and I've regularly done this a lot of times. Whenever SIPAN meeting is on, those of us in education committee and SIPAN NEC, please try and send the ongoing information that your meeting is ongoing to all platforms, both CPAN and non-CPAN platforms. I do send even to Facebook, but unfortunately today I came in late. Each time you don't do such things, you discover that you have lower number of persons in your meeting, and it's not too good for us, because when the presenter has spent so much time to prepare very important information and knowledge sharing practices like this, then we don't have people to even get that knowledge. It cannot easily be repeated next time. So I want to thank every participant. I want to thank everyone that is here tonight. And when people don't ask questions much, I think it connotes the fact that maybe they have understood everything. And I want to encourage presenters next time, please, let us also add something to what we do. When people don't ask questions, please, you the presenter, prepare your own questions, and you finish and you maybe one question. Maybe you should also ask them your own questions. That will make it much more interactive and comprehending. So on that note, let me say thank the presenter, the moderator, all those who have put this together. And maybe if anyone still has any contribution to make, please let us feel free to do it. Because what we are doing is the only way, or one of the most common ways that we learn these days. And when you learn this way, it sticks. I hope I have not taken much of our time. Thank you very much.
Yeah, thank you very much, Dr. Madu. From the chat box, I can see someone asking for recordings of this meeting. So I don't know, Dr. Tisha, will it be available even for the slides too?
The recording will be available.
Okay,
The recording
okay, yeah,
is even live on YouTube, so anybody can go to CPAN's site on YouTube and have access to it.
Okay, okay. I don't know if for the attendance of today, I don't think it was really okay. I think it's still fair, 20. But for subsequent times, I would want everybody to take it upon themselves to post on different pharmacy platform. Like I did on my own to post on the PSN Frontier and even on my state PSN page. So I don't know if everyone can take that collective responsibility in posting on respective platforms to increase participation. I think that will be a welcome development. Dr. Ruth Rebeyi, are you there? I can see you here. Do you have one or two things to say? Contribution or question?
No, good evening. Sorry, I had another meeting, so I had reached out before this meeting. I don't have questions, actually. I don't have any questions, but I must say that the topic is apt, and it's good we are talking about it so that we'll be able to make informed decisions.
Okay.
That's my contribution.
Yeah, welcome, Dr. Woods. Any other person with one or two contributions? Any other person? Dr. Tricia.
Yes.
Concerning this vaccination, I think there are a lot of persons who are still skeptical, especially parents, on wanting their children or wards to receive the vaccine, there are still fears on maybe fears of untoward effects, like untoward effect of the vaccine on the child. So I don't know on what can pharmacists really do in this regard to reassure parents and guardians who try to prevent their children of say 15 to 20 on receiving these vaccinations.
Okay, and thank you so much. Their fears are it's not surprising, after the COVID is the COVID pandemic, and the COVID vaccines actually helped to increase the fears in a lot of us. But as pharmacists, we do know that vaccines, Cervarix and Gardasil have been around for quite some time. It's not like the COVID vaccine that was manufactured because of the disastrous tragedies that were going on. These vaccines have been on for quite some time. So the pharmacists should be able to encourage the parents that, our children of nowadays, I'm being very frank about it, they're up onto so many things. If you recall, I mentioned vaccines, females and males having taken these vaccines as early as 9 years. When we were growing up, what sex was the last thing we thought about? Sex was for much older adolescents. So the pharmacist should. That's the role of the pharmacist, to encourage parents, relatives of these children, that it's important, if they can afford it, to make sure that their children or their wards are covered. In as much as we still encourage them to use a condom and all that, but the vaccine is key. It's just for us to allay their fears. Rightly so, because before this time, vaccines or immunization wasn't a big deal. After all, when a pregnant lady has a baby, the baby goes through all the childhood vaccines, immunization, yes, and no one raises an eyebrow. But after the COVID pandemic, because of the way the COVID vaccine came out and all that, so people were very skeptical about vaccines thereafter. But it's just for us to educate them and always use the childhood immunization as an example, that when a baby is born, the baby must go through all the immunization schedule, the measles, the chickenpox, the oral polio. Yeah. And nobody raises an eyebrow. How do I put it now? It's a norm. That's the word. It's a norm. Once a lady has a baby, the baby goes through all the immunization, schedule. So that we can use that as an example, that they should kindly and make sure and encourage their wards or their children to take the vaccine. It's important because the HPV virus can be deadly. That's my advice to parents and relatives of these young ones.
Yeah, thank you very much, Dr. Tricia. I think I just saw one new hand up, and pharmacist. Oh wow, pharmacist. Oh wow, you can unmute yourself and ask your question.
Yes. Good evening, everyone, and thank you, Dr. Tricia, for the beautiful presentation. Even though I joined late, but then the part I made was quite enriching. You were talking about likening the HPV vaccine to childhood vaccines. I don't think
immunizations,
no, I don't think they equate somehow to some of us. Because when you look at what the vaccine is supposed to to be preventing. It's supposed to be for probably sexually active people, and you want a 9-year-old or 14-year-old to be vaccinated, probably telling them that you could be sexually active or what? Some people's thinking.
No,
Anyway, then those of us that
no,
took part
no, that's not.
in the corona stuff, vaccines, some of us know
Yes,
what we
yes.
went through after the vaccine.
Mm,
Yeah, I was
mm,
sick for quite some time, and my
yes.
system couldn't take it. Just
Mm,
like a lot of people will react to different vaccines. Even all these childhood vaccines, some children also react. It's just that they are
definitely,
probably not
definitely.
documented or thereabout.
Yes.
So if I'm not seriously convinced of giving my children the vaccine, it's a little bit hard to convince people, and this thing just came up. Yeah, you have to give children vaccine. Okay, the age of vaccine has been reduced and the stuff. So we
Mm.
need to do more homework and probably enlightenment for people to understand what it is and what probably might portend. That's just
Okay.
my two comments.
Okay, thank you so much. Could I react to it, please? Okay, I'm a very I'm a very objective individual. Whether we like it or not, our children, regardless of how old they are doing what we never did when they were their age. That's the truth about the matter, whether we like it or not. And the earlier we face the reality, the better for us. If you think that they will be smart enough, and a lot of them are not. If you think they'll be smart enough to use a condom to prevent STIs, not even just HPV. There's so many STIs. HPV is an STI, falls into the STA, sexually transmitted diseases or infections. So if you think that you can educate the children to use a condom before they engage in sexual intercourse, and you're sure that they are smart, sensible enough to do that and not pick up all kinds of sexually transmitted infections, including the HPV, fine. But I don't think knowing what cancer is, I just gave you a life case study of someone who, for reasons best known to her, it wasn't her portion. Now she's almost leaving this world. It's sad because it could have been prevented. So for children, there's what we call sex education. I know when we were growing up, a lot of our parents didn't believe in it. But children being what it is now with social media, the sooner you educate them and they are in the know of what is going on, the better. I'm being very subjective about it. Then regarding the after effects, yes, I agree with you. Vaccines, people react in different ways to vaccines, definitely, because most of them are attenuated viruses. They're not completely dead, that are being pumped into your system and all that. But comparing COVID vaccine with any other vaccine, COVID is in a world of its own because of the way it was produced. There wasn't enough time. All the clinical trials and all that accelerated clinical trials is not the same thing as the old vaccines, like the childhood vaccines that have been on for decades, for donkey years, have been tried and tested and have been shown to be, in as much as the child may develop a fever and all that. You can't compare the COVID vaccine to the vaccines, even to this HPV, the Severus and Gardasil vaccine, which are a bit older than the COVID vaccine. So it's up to the parent. But for me as a pharmacist, I will try my possible best to convince the parents, as I had mentioned before, that your loving dear brother, daughter, or son is doing what you never did when you were that age. So it's good to be realistic and objective and prevent future issues. Because cancer is like a death sentence. Once you have it, regardless of whether it's cervical, whether it's breast, whether it's a prostate, if it's not caught in time, it's a different matter entirely. So it depends on your outlook. It depends on your perspective. That's the word. It depends on your perspective regarding vaccines. You are already biased, as it were. You have your reasons, rightly so. I mean, you have your opinion. That's fine. But for those of us who believe in, like my daughter, she's almost 30. She's still taking the vaccine. Yes. So so that's what I have for that. Thank you so much. Thank you.
I'm sorry.
Yeah,
Let me just chip in something. Hello?
okay.
Yes.
Yeah.
We're still with you.
Yes, I
Yes.
didn't say I was biased, and I didn't say I wouldn't advocate for it. I was just saying that we need to get more facts and probably enlightenment to people than just
Okay.
we're in this group. You understand? Public enlightenment. And
yeah, that's
like
part of it. Okay.
Yes. Public enlightenment needs to go out more. We need to do more of that. And as it is,
yes. It's one of the things that recommended.
It's just like HIV. With all the public stories, you get this, you that.
Yes.
You see that people are still getting HIV. Because abstinence is still supposed to be the best solution, which is not really working, because to abstain for sexually active people and that need to get what they want or the satisfaction they need, they still get to do it.
Yeah.
And they throw all cautions to the winds and the stuff. May God help us.
To the wind, exactly. True. Yeah. Yeah, you have that's the take home, yes. Creating awareness, which is what I said before, very important. Any opportunity you find yourself, any gathering. I do a lot of medical outreaches and I use that as an opportunity, especially when it comes to speaking to the female population. What I usually do, especially if you're going to the village, I use a balloon. I use a balloon as my cervix and I explain to them and all that. And you'll be surprised. They come, when it's over, they come, especially the young ones. They didn't know their mom died of this, this is, different things. And then they start asking questions. So I use medical outreaches as an avenue for, as you rightly said, enlightening the populace. Even the men, my presentation also mentioned men. Men also carry the HPV virus, and they're also encouraged also at the age of 9, although I know in this country it may not happen, but they're also encouraged at the age of 9 to take the vaccine as well. Because there's also anal cancer, there's also penile shaft cancer, from the HPV, there's also genital warts, which also affects the male population as well. So that's the take home, awareness, creating awareness among the populace about what cervical cancer, anal or penile cancer can do to an individual. Thank you.
Yeah, thank you very much, Dr. Tricia. Okay, I was seeing a hand up by Farm Rachel Omayuku, but now lowered down. Still any question, Farm Rachel? The answer was up like say 3 minutes ago, but it's now lowered.
Well, good evening, everybody. Good evening.
Good evening.
Yeah.
Actually, I wanted to contribute to what they are saying, and I've already said what I wanted to say about enlightening parents, and without not necessarily letting the children know. It is parents that the children are under the parents' care, and they are the ones that actually need to understand There is a future event. It's not
Yeah.
today. That's what I wanted to say. That they need to be enlightened, and then they will be the one to bring their children for vaccination. And when they know that this thing is not, it doesn't mean that your children are promiscuous. But in case
Yeah,
something is happening without you
exactly.
knowing, then you will know that you are preventing
Yeah.
something. That's what I wanted to say. And
Yeah.
I had a question on the chat box that what are the treatments for cervical cancer?
Okay.
Because you did not mention it.
I didn't because I was talking about prevention, but I can mention it now.
Please,
I actually have it, but I didn't want to mention it because I was talking about prevention. So actually for the preventive measures, there's actually a third, it's called a tertiary preventive measure, but that one is for when precancerous lesions have already been identified and they need to stop. Something needs to stop them before they progress to full-blown cancer. So the treatments include, just a minute, okay, includes excisional, that is excising that particular lesion or the suspected area and sending it for histology. That's one. It also includes radiotherapy, includes surgery, it includes debulking. Debulking I won't use debulking. Debulking is when there's already cancer. We're talking about trying to prevent the precancerous cells from becoming full-blown cancer. So the first one is excising. You can excise, and there's another one they call freezing. You freeze. I don't know if it's done in this part of the world, but that particular suspected area can be frozen. There's a particular terminology for it. But what I know that we do practice here is incising. You cut off that particular area and you send it for histology to ensure that the margins where that particular area was removed, it hasn't spread, to be sure that whatever you have actually identified has been contained within a particular area. So that's basically it. When we're talking about radiology, radiotherapy, chemotherapy, that's the end state. Not one, I won't say the end state, but that's when it has become full blown. But for the precancerous stage, is to incise and send for biopsy. Incise that section and send for biopsy.
Thank you.
Okay, thank you,
You're welcome.
Dr. Tisha.
You're welcome.
This is really very, very, very enlightening and educative at the same time. Any other person? Okay, I'm with you.
What I wanted
We can
to
hear
say,
you.
sorry for cutting you, and I'm sorry for that.
All right.
Our take home really is that no female, at least in our nation, Nigeria, as much as we can as pharmacists, no female should come down or should die from cervical cancer. That's our take home, because it's 90%, as I had mentioned before, 90% preventable. It's just to encourage the female population to do the pap smear. Okay, so now for the pap smear, I am currently in Port Harcourt Teaching Hospital, University of Port Harcourt Teaching Hospital. The pap smear that we carry out here, for those patients who are under NHIS, it's free. But if you want to pay out of pocket, it's 7,500. That's for the pap smear. That is the teaching hospital here. I don't know about other teaching hospitals, but the teaching hospital here is 7,500, and that is done once every 3 years. So I don't think it's too much compared to what is preventing, the benefits of preventing you from coming down with it. 7,500 once in 3 years, I don't think it's too much. That's if you're paying out of pocket. But if you are going through the NHIS scheme, it's free. So we should try and please, pap smear, which is a cheap one and is very common. The HPV test is a bit more, it's not that common. It's done, but it's not as easily accessible, and it's not as cheap as a pap smear. The pap smear is good. Once you do it once every 3 years, if there's any abnormality, you're told to repeat it, so you're rest assured, because it doesn't give you sign. It doesn't you don't know. By the time you start bleeding, like the technician now, by the time you start bleeding, it's too late. In fact, the stage at when you start bleeding and there's pain, it has gone far. It's already the third stage. The different stages of cancer, regardless of what part of the anatomy of the body it is. By the time you start bleeding, it's already too late, and it's cervical cancer. You're already in the third or fourth stage. So we should please encourage the populace to please do the pap smear. If they can't do the vaccine, what I tell when I do outreach is what I tell the female folk, depending on the caliber of females I meet. If it's a village setting, obviously for now the vaccines are expensive. Yes, the federal government has brought in a lot, but we don't know how accessible it is to the populace. So in the interim, they should do the pap smear. I think that's the cheapest out of the three approaches. The cheapest, pap smear, and it's very effective. So that's my take for all of us. Thank you so much.
Yeah, thanks, Dr. Tricia. Yeah, thanks so much, Dr. Tricia. Because I've really seen a patient suffer and die of this cervical cancer. It was really a terrible situation, because at that point, what we were doing for that patient was actually management of pain. The patient was placed on pentazocine 30 milligram like every 8 hours. It was just like at that point there was already an irreversible, irreversible illness. So is somebody I watched the person, though the patient presented late, at a point where nothing else could have been done. So she was just managed on painkillers, pentazocine and injection, even with injection tramal and injection diclofenac. So I watched such person die. So I think pharmacists should take it as a point of duty to, to enlighten the patient, to tell them on what cervical cancer is. And I think the pharmacists should be able to catch them young, because we tend to get certain complaints from patients too. So I think pharmacists has a role to play in early detection of this stuff, because sometimes when they present to the doctor, the doctor may not even do their clerking properly. But at the point where such patients interface with the pharmacist, I think the pharmacist can be in a very good situation and position to identify these cervical cancers at very early stage, and also suggest tests that could be done.
Yes.
Yeah.
Very true. Thank you for that. Thank you.
Yeah. So I don't know if there is any other question or contribution from anybody. Any question or contribution, so that we call it a day for this presentation. Any other person? Any other person? Okay. So I think in the absence of on the present on the slides, someone made mention of it being available through email, right?
Okay. What I will do is I will send it to Dr. Bello. You know, he's the educational. He's in charge of.
Okay.
Yeah. So
Then
I'll just send it to him.
on
I'm going to put it on the
then
platform.
on the forum, interested persons can drop their email addresses there so that they can get slides of the
Exactly. I'll just send
presentation.
it to Bello. Yes.
Okay.
I'll send it to
Yeah,
Bello.
very lovely presentation from Dr. Tricia from University of Port Harcourt Teaching Hospital. So I hope we'll hear from you soonest again on another topic very soon.
Thank you.
Hope we'll be hearing from you very soon again, Dr. Tricia.
Yes, I'm always there. I'm always there to impart knowledge, especially what I'm passionate about. Definitely. Thank you.
Yeah. This is really a topic of good interest. A topic of good interest. So in the absence of any other question or contribution, I think we should call it a day. Thank you very much, Dr. Fisher. Thank you.
Thank you so much. Thank you everyone for listening. Thank you for your time. It's really worthwhile. I appreciate your patience and your participation. Thank you so much. Thank you.
Yeah. So good night, rest to everyone.
Yeah. Everyone. Thank you so much.
Everyone, good night.
Have a lovely night.
Good night. Thank you, Dr.
I hope you are well preparing for SIPAN next year, SIPAN International Conference. I hope we're all preparing to attend. It's going to be very exciting. Yes, so we have training, hands-on training, X-ray reading,
everybody should be prepared.
ECG. Going to be very interesting.